Hey guys, welcome to another video. Today I'm going to do the second part of the two-part series I have on videos featuring Vincent Antunez. He's the founder and president of Trail Toes, the foot care cream. He also manufactures other things like the tire trainer, and he now has a thing that goes around the neck that helps cool you down. He's a associate professor at University of North Texas. He also was a military medic for over 30 years. He talks a lot about his history working with the soldiers' feet. Helped him a lot in understanding what needs to be done. He has a lot of medical training. Today's video will be pretty much focused on foot care. He talks some about preventing problems, how to treat your feet, what to do if you hit a problem, and then how to treat the feet if you have a issue during a long distance race. He has crewed for lots of people doing 100-milers and multi-day events over the years. He also he's run several too, and he does a lot of multi-day events in different parts of the world. He definitely has a lot of knowledge. I really enjoyed the time. We had him for this presentation at the Trailhead Running Supply that I work at, and he came in and did the talk. We ended up being there for close to 2 hours. The talk was probably a little bit over an hour, and then he let people practice. I tried to video some of that, but it really was not to where you could see what was going on very well, so I will not show that. But I'm going to present now him talking about foot care, and I hope you find it interesting. I hope you find some information that's useful.
But you got to stop and eat at some point, okay? And I can't control your brain because, you know, one day you'll have a good race and another day you won't have a good race. And so you just got to pick it out, okay? So I'm going to talk to you guys about blisters, and I'm going to talk to you about kind of the interfaces of your body and the road, okay? So first is the road or the trail that you're running on. Are you running on flat pavement, or are you running on terrain? Are you running on terrain that has a camber to it, or are you running on trail where you have to, you know, sidestep and things like that, especially going downhill where you're jamming your foot into your shoe, okay? Those all matter, so just you have to know what your terrain is going to be like, okay? And then we talk about the shoe itself. So there's a lot of controversy, and I don't run a shoe store, so, but there's a lot of controversy, like if you're going to run a 100-miler, should you wear a bigger shoe? Should you wear a shoe a size up from what you normally wear, half size, size and a half? You know, you ask Dean Karnazes, he'll tell you one thing. You ask Harvey, he'll tell you something else. You know, most runners usually will go up a half size for longer distances. I'm not necessarily on that program, but that's, again, it's the runner's choice. But that is something to think about, and we'll talk about ways to get away with that if you choose not to switch out your shoes. So we talk about the shoes itself. So when we talk about shoes, I'm gonna dive into your realm for just a second, okay? So this is my philosophy. So the Army, Navy, Air Force, and Marines have all done studies on shoes, whether you get motion control, stability, or comfort shoes, or cushioned shoes, whether you get one of those three, it doesn't. So, you know, which one is for you? Are you pronator, are you supinator, all that stuff, which one is you? And one study from the Army had 3,000 participants in it, and some were pronator, some were supinators, and some had a neutral gait. And they found that it didn't matter whether they gave them motion control, stability, or any of that. What mattered was whether the shoe was comfortable on their foot when they tried it on. Okay, so I always tell people when they try their shoes on, they should go at the end of the day. Okay, not because your feet are more swollen, but you've been on them longer, so they're a little bit more tired. You're a little bit more fatigued. The other thing I always say is always wear the socks that you're going to wear when you run. Like I'm wearing exoskins, but I just started trying these. But before that, I only wore Injinjis, and so anytime I went to go try a shoe on, always have a pair of socks that you're going to run in. Why? Because that's what you're going to run in. You're not running in the socks that's in the bucket. Okay, so and some of them are thicker, some of them are thinner, or whatever. But always wear the sock that you're going to run in. And usually, if it's a race day sock, I always wear brand new ones when I run a race. I try not to wear older ones just because they've lost some of their cushion and all that stuff. So, but when you go there, go at the end of the day with the socks that you're going to wear for your race, and then when you go to try your shoe on, try a pair of shoes on that fit, okay, that fit you. And while you're in the store, and I'm not sure about this store, but I'm sure that they'll let you do that, where you can walk outside, you can, take it for a little bit of a stroll, but leave it on your feet for at least 20 minutes. Okay, and then make sure that it's not too tight. Make sure it's not too tight in the forefoot, the midfoot, and make sure that your heel fits comfortably in the arch. And if it doesn't, take it off and get another one. I did a race. Where'd I go? I think it was in the Sahara. It might have been Marathon des Sables. I tried on over 35 pairs of shoes before I bought the pair of shoes that I bought and took. And even that shoe was wrong. When I finished that race, I actually left those shoes in Morocco. So back to the drawing board. But you should always wear the shoe, wear them out. And then when you buy the shoe, buy the shoes and buy 2 pairs, okay? And if you can afford it, buy 3, because you'll never see that shoe again. Okay, you'll never ever see that shoe again. And even when you buy that 1 pair of shoe, try the second or third pair on as well, because there may be a little bit of different stitching and things like that. This one felt really good, but you try the next one on, you're like, wait a minute, this is not even the same shoe. How does that happen? But you remember, they're sewn by we're sewing these things together. I sew it just a little different than he does. So it's all going to be a little bit different. But you'll never see that shoe again. My friend John Sharp, he went and bought like Nike Yacht White Horse. He bought 8 pairs because he loved that shoe so much, and he knew it was never coming back. So, and then if you buy multiple shoes, you should rotate them, because that way you don't lose the elasticity in the heel and in the forefoot that you're going to have with just wearing 1 pair of shoes all the time. So we talk about shoes, and then so we talk about socks. Whatever sock you're going to wear, what's really important about socks is that when you take your sock, I thought I brought another pair with me. I brought all kinds. I ran from work home and I just started throwing stuff in here. I don't think I do. More.
I've got the bucket of socks over here.
Yeah, grab me a bucket of sock. Grab me a sock from the bucket. I'm gonna take my shoes off anyway. So when you get socks, and people don't ever really talk about this, is that, and this is a good sock to look at. Actually, this is a perfect sock to look at. See all this right here? So all this is potential for binding up, creating a point for shear forces, which are then going to cause heat, which are then going to cause blistering. So what you do with these socks is you take a pair of scissors and you cut all this stuff off. And Injinjis are notorious for that, because in Injinjis, the way that they sew the toes, there's a lot of extra thread inside that if you never invert your sock, you'll never see it. But all of those are potential hot spots. So make sure that you take your sock, invert it, and trim all this stuff down, because each one of these things is basically, if this balls up, what is that? It's a little pebble in your shoe. Okay, so get rid of it. That was a good example, and I just grabbed that first pair right there. It was perfect. So take care of your socks. And then let's talk about your feet, okay? So toenails are a big thing, okay? go get them cut off. You can go get it. Go to orthopedic, go to a podiatrist, and if you're an ultra runner and you don't want to have subungual hematomas, I'm just going to use big words so it sounds like I know what I'm talking about. Okay, that's just blistering underneath your toenail. If you don't want to have those, just go get your toenails taken off. You're not rooting in the ground for any any ants or anything like that. You're not trying to dig through trees to get grubs out of them, so you don't really need them. Some of the best ultra runners have all done that. They go in to get their toenails removed, but nobody's going to do that. Okay, so yeah, but you can do it. So what we do is we just take your toenail off, and then what we go in, we use either silver nitrate, which I don't like to use because it leaves a bad reaction on your skin, but we use phenol, and what it does is it kills your nail bed. Okay, and then your toenails don't grow back. Hopefully they do it right the first time, because a lot of times they don't kill the whole nail bed. Your nail's still going to grow out. So now you got like a little fang coming out of your toe. You got to go back in and have it done. So you got to be careful about that. Okay, but if you don't want to have your toenails removed, the next best thing is to do what? Is to trim your toenails, okay? I always tell people to trim their toenails about 4 to 5 days before the race. And why do I say that? Because a lot of times you get overzealous with it and you start cutting it back. You're like, I don't want this anywhere near the toe box. And so I'm going to cut it back, cut it back, cut it back, cut it back. And then you cut too deeply and now you're bleeding. Okay? The reason I say 4 to 5 days is because usually the inflammatory process is over 72 hours. And so if it happens that you cut it too deep, then hopefully your skin has been healed by that time that you go to run. But you don't want to cut back too early. Toenails grow, so fingernails grow 2 to 3 millimeters per month. Toenails about 1 to 2 millimeters per month. So they're a little slower growth than your fingernails are. Might be 3 to 5 on your. I think it's 3 to 5 on your fingernails and 2 to 3 on your toenails. But they're a lot slower growing. But you want to cut them back so they're very close, so they're not beyond the end of the toe. Okay. Be careful about cutting into the cuticle. Okay. Because that can cause problems and pain. But you don't want to cut too deep into it, because if you cut in too deep, as this grows out, that's where you get the ingrown toenails from. So that's why when you cut close to the little fold in here, you want it to be just beyond that by 1 millimeter or 2. So don't cut into the fold.
You just cut straight across.
I like to cut straight across, but to me that doesn't look good, so I do curve the ends a little bit, because I think it's better to have a rounded edge. And we'll talk about taping. When we talk about taping, we always round our edges with taping. And it's the same thing with your toenails. If you cut straight across, that can catch on your sock, and it can cause problems. Okay. So I always like to round everything. Okay, I think it works better.
If you do get an ingrown toenail, cut the little notch in the top helps, because it actually grows together, pulling in.
Well, yeah. So there's a bunch of different ways to talk about ingrown toenails, and so one of the easiest ways to do it is just soak it in water and a little bit of 1/3 hydrogen peroxide, and then soak it in there. And when you're in there and the toe gets really, really soft, dig in there and kind of open it up a little bit to get that bacteria out of there, because the bacteria is not letting even that hydrogen peroxide get in there. Bacteria forms a slime wall, and so you got to remove that slime wall. So you got to cause pain to cure yourself. So you got to get in there with a Q-tip and clear it out and things like that. Actually, one of the ways they do treat it to keep it open is some people will take a little piece of cotton, they'll tear the cotton off and they'll shove it in there to keep it open that way. I don't prefer to do that, because I always worry about people forgetting and leaving it in, or they're not being able to get everything out. So I don't like to do that. I just say soak your foot 3 times a day, and while you're in there, just kind of even use your own toe to kind of open it up like this. It's painful, but whatever, you get through it. Okay. So and when you buy a new pair of shoes, anybody ever wore orthotics like for plantar fasciitis or anything like that? So when you first got them, did you wear them all the time, every time? You did? It's not really the way they're supposed to be done. When you first get an orthotic, because your foot's not used to it, they tell you to usually wear it for like an hour or two a day, and then 4, 5, 6, and then all that. I tell people when they get a pair of shoes, the first pair of shoes, take it home and wear it as long as you can wear it. If you can wear it to bed, wear it to bed. Okay? Because if you're doing a 100-miler, you're in that shoe for 24 hours. Or for most of us, like 32 hours. Okay? So you're in that shoe for a long time. So you want to know how it's going to feel on your foot as your foot gets really, really tired, or when you need to curl up on the floor to go to sleep during a run. So all that stuff matters. Okay? The other thing I say about new shoes when you're wearing them, sometimes it helps if it will work, is that, you know, when you first buy a pair of shoes, there is no imprint, right? But this now has an imprint. Why? Because I've been wearing it for a while. So what I'll do with a new pair of shoes is I'll take this insert out and I'll put it in the new shoe, okay? Especially if I'm going to go out for my first run or something like that, because I already have this imprinted. It won't always work because not every insert's going to fit the same shoe. Just something to think about, okay? Because otherwise it's just like wearing a pair of orthotics for the first time. And when you wear those orthotics for the first time all day long, is it comfortable? No, not at all, right? So what they should have said was you only wear them for an hour or two the first couple weeks that you have them, and then slowly work your way into them. Because your foot's not used to it. Your muscles aren't used to it. Your tendons and your ligaments are not used to that new arch or whatever they've fit in there. So that's why they usually say ease into them. Same thing with a shoe. I do say when you first get them, though, wear them as long as you possibly can to see how well they hold up for your foot. And if you don't like them, take them back. Okay, they got plenty of shoes here for you to choose from. Okay. Okay, so we talked about shoes, we talked about socks, so we talked about toenail care. Okay, now let's talk about lubricant. You know, obviously there's really only one lubricant on the market that's worth a shit. So that's not true. Although I got this really cool email from this guy that did the Badger 100. He wrote me this cool email. He's like, your product, if it wasn't for your product, I wouldn't have finished. And so, you know, I was like my first email this morning. I was like, oh, that's so awesome. So there's all kinds of lubricants. If you're going to use a lubricant, use it, okay? And don't be shy with it. You know, yeah, okay, so my jar of cream, I'm not sure what you guys saw it for here, but, you know, it's like 12 or 13 bucks. But, you know, if that's 12 or 13 bucks is going to help you save that 350 or, you know, some races are, you know, some of the races I do are $3,100 or something like that for the entrance fee. You know, you want to finish. You know, my only rule of thumb was to get whatever t-shirt and medal they had at the end, okay, to justify the expense.
Yeah. $3,100 t-shirt.
Yeah, usually it's a crappy t-shirt too. Like the Brazil 165, I think that t-shirt was made out of, I don't know, paper towels or something. It's so thin. But that's a great guy. That guy's a great guy. The Commodore, he calls himself. So lubricant, if you're going to use it, and use it liberally, okay? Most lubricant, it's funny, you know, when I started Trail Toes, I started the company in 2013 when I was in Afghanistan on a mountaintop doing medevac missions, flying wounded people off the battlefield as a PA, which was unheard of at the time. But it was fun, to a degree. But anyway, so I started the company in 2013 while I was on a mountaintop in Afghanistan. And I named the company because the name came from, I had a bunch of medics in the room and said, hey, I got this idea to start this company, but I need a name. And, you know, we were going to make a cream, blah, blah. We wanted to call it like Sweet Feed or something like that, you know. But the problem with names is you have to have the .com to go along with it. And so a lot of the .coms that we wanted, we couldn't get. It's like, well, how about Trail Toes? And so that's where the name came from, a bunch of medics and me sitting on a mountaintop in Afghanistan. In between air medevac missions and other things. But anyway, so The problem is that when we called it Trail Toes, I would literally, when I started selling the product for the first time in 2013, and the first place we sold it was at the San Antonio Rock and Roll Marathon. And I had delusions of grandeur, but it didn't work out the way we thought it would. But we've still been going since 2013, so it's working out okay. I named it Trail Toes, but people would buy the product and they go, "Can I put this any place?" I'm like, or I use Trail Toes on my toes. I use Body Glide on my foot. I use squirrel nut butter on my nipples. It's just like no, it's all the same. It doesn't matter what cream you use. It can be used anywhere. If you can use it on.
If you're not familiar, don't borrow anybody else's Trail Toes or any lubricant.
Yeah, you shouldn't. Yeah, especially like the stick, because usually people buy the stick so they can put it in their groin. That's why they buy the stick. But anyway, but all the cream can be used anywhere, and it doesn't matter which one you use, but just use it liberally, especially on race day. Just use it liberally. And if you start feeling any problems, stop and reapply. So always keep some with you. I was doing Badwater, this last time out here, and I was taking care of my runner's feet because he had really bad blisters. And it had nothing to do with the cream. It had to do with the fact he was blind, and he was doing this a lot of times just because, so there was a lot of shear force on his feet during the run. But I was thinking of his foot, and somebody came up and said, "Are you the Trail Toes guy?" And I'm like, "Yeah." He's like, "Do you have any Trail Toes?" And so I reached into a 4-ounce jar I put it in a plastic bag, and I gave it to him, and I said, drive on. But use whatever you got liberally. So you can use most of it. You can use it on your feet. You can use it in your thighs. You can use it in your groin, butt cheeks. If you're wearing a pack, you can use it on your pack where there's stresses on your pack. You can use it on your nipples. I personally tape before every race my nipples, just because it's just easier. I think you gotta be careful taking the tape off though. Women along the bra lines, absolutely.
Run without putting it there.
Yeah, so all of that, yeah. But use it liberally, okay? And then if you start feeling hot spots, stop and take care of your feet, okay? You have two options when it comes to that. One is suck it up, because I'm close enough to the finish where it's not really gonna matter. Because if you're within 10 miles of the finish, to take your shoes off and do all that stuff is going to take you longer than would probably not true, because it's usually at that point you got 3 hours left anyway. So, but you still got to make up your mind whether or not you're going to do it. But once you take your shoe off, though, if you're that far into it, it's going to hurt to put them back on, and it's going to hurt to get going, and you're going to be slow. But if you got a good pace going and you're able to suck it up, just keep going. But if you're 60 miles, you got 60 miles left, stop and take care of your feet. Listen to your body. It's telling you something. If your belly's blowing up, that means you're not getting enough salt. It means if you feel nauseous, it's because you're not eating, okay? And so you got to take care of it. So stop and re-lube with whatever lube you're using, okay? And then look at your feet. Now here's the problem, or here's the point where people kind of, okay, what am I going to do now? So if you see a hot spot, usually you can get away with just putting more lube on, okay? Or if you're close enough to your bag, you can let your feet air out for a little bit and let them dry out, because they may be macerated from sweat or whatever. And then put a new pair of socks on, lube those up, and then put your shoes back on. If you have a drop bag and you have multiple shoes, you can change out your shoes. That sometimes helps as well, because it changes the dynamics of your foot, especially if it's a completely different shoe. It changes the dynamics of how your foot is in the shoe, so it may create different stress forces on you, which will allow you to continue. And then, but if you have a blister, then you got to make a choice of what you're going to do with it. Okay, do I pop it? Do I dress it? And do I drive on? Okay. Most people will say if it's a blood blister, if it's red in color, that's a blood blister, and you shouldn't pop it, because then that's more vascular. It means that more capillaries involved, and so you can introduce an infection. My personal opinion, if I'm your crew, on your crew, I'm gonna pop it, I'm gonna dress it, I'm gonna, you know, but I have to say it that way because medically, if I tell you to pop it and you get an infection, I could be liable for that. So, but you really, if it's a blood blister, you shouldn't pop them, okay? Although I do. Okay, and then if you have a blister, should you pop it? And I would say that a lot of times what happens is, let's talk about calluses, okay? You're an old timer, right? You guys just look old. But you know, you remember you used to go to the gym, right? You work out and you get callus on your hand. You'd be like, yeah, you go out and show your friends, you know, I'm all hardcore. Look at me, I'm all bad, you know, whatever. And we thought that was a good thing. Well, a lot of times early on, thought blisters were good or calluses were good on your feet too. The problem with blisters or calluses is that it's immobile tissue. It's highly keratinized tissue that does not move. And so as a result of that, because it's not pliable, it stays in place and it causes more shear force, which then causes more heat, which then causes a blister. And what will happen with that tissue, because it is so keratinized, that blister underneath will lift that whole callus off your foot. So if you have a callus that's, you know, like say underneath your big toe, because that's where a lot of times they're going to be underneath your big toe, maybe on your small toe. But if you have a big one underneath here, that hole under that metatarsal head of your big toe, that whole thing is going to lift off. Literally it's going to lift off because there's nothing to secure it. There's all that, all the attachments have been destroyed. Okay, so it's literally going to lift off, and now you went from what would have been a small little blister to now having all of this just now potentially falling off. So how do you take care of calluses? So yeah, so the best way to do calluses is get a foot bucket like this, fill it up with warm water. It doesn't have to be filled up all the way, but as hot water as you can possibly stand. And you could put Epsom salts in there if you want because it's more soothing or whatever, but you don't have to, just warm salt water. And then once it gets cold and your foot's a little bit wrinkly, wait till it kind of plumps back up, and then get a pumice stone. And don't go to pumice stone, don't go to Bed Bath & Beyond and spend $50 on a pumice stone. Go out to your backyard and grab a stone from your backyard and use that. And while your skin is soft, just kind of rub that stone on there to get rid of that callus, but don't try and get it all in one sitting, because if you do, you're going to cut your toe up and stuff like that. So you just want to kind of slowly whittle it down till it's gone, okay? And then after you've done that, take a little, you know, whatever, you know, Trail Toes or whatever cream, you know, cocoa butter or something like that. After you've taken that off of there, put some of that on that skin because that way it will help keep it moisturized, okay? So calluses are bad. In the old days they were good, but we realized that they're not very. I saw this one dude in, again, I think it was China, might have been, no, I think it was Atacama actually, and this guy had a bunch of callus on his foot, and all of his foot was callus, and he got bad blister underneath, and this whole thing just lifted off, and literally you could see the bottom of his foot, not to the muscle, but you know, through the dermis, and so it was pretty bad. It just looks nasty, or like face off kind of thing. Yeah. But anyway, so you wouldn't have taken care of that guy. You wouldn't have gotten anywhere near that guy. So, but calluses are bad, so take care of those. Toenails and calluses are bad. Okay, so now, if you have a blister, there's a couple things you should have in your. So let's talk about.
So you brought some whiskey for us.
Huh?
I see you brought some whiskey for us.
Actually, I like to go to the, I quit drinking, so I don't, but I like to go to the liquor store and get their boxes, because their boxes are really thick, and so when I send out race stuff to different race directors, I use liquor bottles or boxes because they're nice and thick and really supportive, but you have to cover that up because they won't. Okay, so at some point, you're going to get a blister. Right? There's not a distance out there, and you could run the same 5K around your neighborhood every day, and at some point, you're going to get a blister. It's inevitable. It's just going to happen for whatever reason. So what should you have in your blister care kit? I don't know. There are probably a lot of people out there. The way I developed my blister care kit, this is how I did it. I walked in with a bunch of I used to teach at the Army's PA program, or the Inter-Service PA program, so we had people from the Air Force, the Navy, the Coast Guard, the Army, all worked in the same facility. So one day I walked in, and I threw a bunch of stuff on the table, and I said, look, I got this company, I sell this cream, but inevitably somebody's going to get a blister. I need to have a blister kit for them. What are we going to put in this blister kit? And that's how we developed the blister kit, okay? I had quite professionals all helping me out from all branches of the service, and that's how we came up with it. So, a couple things that you definitely need, okay? Or you can just buy this. This is actually called the Trailhead foot and care kit. Why is it called that? Because I was having a conversation with Darren and Kathy when they first were opening this place up, and I said, I need to have a kind of an intermediate blister kit, and I'm going to name it in honor of your company. And so that's where this came from. And what's nice about that is it stands up. It's the only one I have that stands up. So, and the only reason I made these is because I bought a bunch of these for something else, and it didn't work for what I wanted. So I'm like, okay, I'll make a blister kit out of it. Okay, so you need some form of cream, okay? So you know, I have, this is my, the Trail Toes foot and body cream, but I also have these little 10-gram packets that I put inside these packets right here. This is actually 40 grams right here. But so I have packets of cream, and whatever cream you have, it doesn't really matter. You support whoever you want to support, but remember me, okay? And then, so I like to have cream, but probably before so this is kind of, I have in the packets because I tell you that if you're running and you don't have your own little jar, bag of whatever you're going to use, then my packets have 4 10-gram packets in there. And this says 10 grams, but I fill these up, and every one of them, because I like get lazy, I'd be like, oh, that's 12 grams, 15 grams sometimes, whatever. But they're in there already. And they do. So you should have a cream in there of some sort so you can reapply. Now, you've had that, the cream's failed. Now you got a blister. Okay, so now we got to take care of the blister, right? So how are you going to do that? A couple different ways. So I highly recommend that you get sterile disposable needles. And these come in different sizes. I like the 1-inch because it's just smaller and it makes it more compact. They come in a bunch of different sizes. I use an 18 gauge. I think an 18 gauge needle is fine. They come in different gauges. The smaller the number, the bigger the gauge, okay? So 14 gauge, like if you're gonna push blood, usually it's better to have a 16 or a 14 gauge needle to push blood. You can do it through an 18 gauge needle, but it's a smaller opening, so there's a risk that you're gonna lyse some of the red blood cells. So 18 gauge needle, and I like the 1-inch ones, okay, and these are sterile. One of the best places to go to get them is just go to like a Tractor Supply, and they have a vet section, and they sell them, and they're actually cheaper, and they come in a nice hard plastic container that works really well, okay? So you can try those 18 gauge, and I'll show you why you need those. I also like just regular safety pins. These are just heavy duty safety pins, not like the ones you get from the race director. They're like, don't even barely hold the number on your shirt, but I like these because if I run out of these, then I can always use these. And you can sterilize it with. I also have alcohol pads, but you can sterilize these with a lighter. Just cleaning it off with water before you put it in your skin, because you're not actually putting this inside your skin. You're actually underneath. You're outside of it because you have that blister there. Okay, so I like to have safety pins. Okay, and then so I pop the blister and then I have to dress it. Okay, so what do we use to dress it? So I use a triplet antibiotic ointment, and these all come in the packets too. And this is like 9/10 of a gram, which is not much, but you don't need much. Like people always always put way too much ointment on. Like is Steve your brother?
Yeah.
Yeah, so when he had his injury, I'm like, dude, take some of that stuff off, because I was emailing him separately on his dog bite. But I was like, take some of that stuff off. For this, you just need a little bit, okay? And again, just like a little dab will do you. That's what you need, just a little bit over there. Okay, put that on there. Somebody's yelling at their mom.
No, it's excessive, whatever.
Yeah.
That's me when I'm getting my blister treated.
Yeah. So generally what I do is pop the blister, I'll put a little ointment on there, and then I'll put tape over it. And that's what we're really here to talk about, is taping, okay? But prior to popping the blister, you need to clean it, okay? So I always have alcohol pads. And when you buy alcohol pads, always buy the large ones, okay? Because they come in different sizes. Most people buy the small ones because they're cheaper. The problem is you can't clean anything with it because it's like this big. It's like a Tic Tac that you're trying to clean your foot with. But always, if you're going to buy alcohol pads, always buy the big ones. And McKisson is a brand I buy them in bulk, so I buy a whole bunch of them at a time. But those are in the kit too. So I clean it. You might also want to use 2x2s, and so when you're buying 2x2s or 4x4s, and actually 4x4s would be better, especially if you have them in a drop bag. 4x4s would be better, okay? But what you want is the gauze sponges, not the gauze pads, okay? Because gauze pads look like the bottom of a Band-Aid, okay? They're not porous. They don't absorb. They're not porous. This is a sponge. Okay. See how this is woven, and there's different woves too. This is a 8-ply. There's 12-ply and all that stuff. I want a 12-ply, but it's really hard to find a 2x2 with 12-ply, which means that you have 12 weaves per inch or whatever it is. Okay. And I always get the 2-pack. Okay, but what you want is, again, you want the sponges, because these are going to absorb. So when you pop the blister and you hold this down, this is then going to help absorb that fluid. That pad doesn't absorb it as well. Okay, and speaking about Band-Aids, they're the devil. Don't use them. Don't use them. Duct tape, don't use. Forms of my tape have it and some don't. So what I'll do is I'll take this, and I see that line right there. So what I'm going to do is kind of cut along that line like this. And what did I say? Anytime that you cut tape, what should you always do? Round the edges, because if you don't, what will happen is when this sits, that sharp edge right there will start to peel up. It doesn't happen as much when you round the edges, okay? There's still potential for it, but it's less likely. And this is where I would take the benzoin. So I would take the benzoin, I'd swab the benzoin on, and benzoin you got to wait till it dries before you can apply the tape, okay? So that's time. So tell your runner that you want me to do this, it's going to take a little bit longer because I got to make sure that dries. And you can feel the tack on it. When it's tacky, you'll know what it's drying on. So you take this like this, and you're just going to fold that over like that. And when you do this, you be the cool guy, right? See, don't do this. Be the cool guy. Just tear it like that and lift it up.
So we're taping their toes to keep them from blistering.
Right. Or blisters developed.
Or for treatment.
Oh yeah, or blisters developed.
But do you recommend doing it to prevent blisters? I mean, I know that's a fine line, right?
Yeah, so here's my take on pre-taping. Okay? So if you run and this foot always gets a blister right here, tape it.
And tape it.
Doesn't matter what happens.
Tape your toes is just tape.
Don't know, because you change. The problem with taping your toes before, especially before a run that you've never run this race before, I bought a brand new pair of shoes, I bought a brand new pair of socks, and now I'm going to pre-tape. The problem is that your foot is not fit to that shoe yet, okay? And now you're going to tape it, so that doesn't look thick, right? But anytime I add any kind of thickness to the inside, I'm going to change that dynamic inside the shoe, okay? Does that make sense to you? So if it's not something you normally do, don't do it. So I differ. So if you read the book Fixing Your Feet by John Vonhoff, huh?
Notice that I've heard of the book.
Yeah, so John Vonhoff is like the father of whatever, a blister care. I've met him on several occasions, and I actually met him a long, long time ago out at Badwater. When they used to do blister care out at Badwater. There was a team, especially like at stovepipe wells and stuff like that. So what I'm going to do is I'm going to put this on here, and I'm going to rub this in. Okay, and the reason I'm rubbing it is because heat from your finger is going to activate the glue just a little bit. And you can take this and just do this as well. Okay, and that little friction is going to do that. So what I'm going to do is I'm going to make sure that when I put this on, there's no creases. I don't want any creases, because what's that crease is a little stone inside the shoe. But you see I got these little ears right here. Okay, so what I'm going to do is I'm going to cut the ears off because I don't like that. Okay, sorry. Okay. So again, what I'm going to do is, what did I do? See how smooth that is? That's what you want, is you want it nice and smooth. This is where John Vonhoff and I differ, because John Vonhoff will do this after, okay? What he does generally first is he puts this one, he puts this one on first, and then he puts this one on over. I don't like to do that, because what happens now is when he was running, this is pushing down and it's actually forcing this apart, if that's on top, okay? So what I'm going to do is this. I need to make this a little smaller, I think. See how I do the cool guy way. And then what I'm always going to do is I'm always going to go underneath it first, and I'm going to try and capture that area where I cut the ear off, come around and come up on top, and again try and capture where I cut that ear off, come around, and then rub it in. See how nice and smooth that is? Now, this will help keep this, so this cut right here is allowing this to splay a little bit when you're running, okay? And this is keeping this in place. Does that make sense to you? Okay? So that's how you tape a toe. And they're all the toes are taped the same way. It doesn't matter if it's the big toe, second, third, fourth, or small toe. Doesn't really matter. Okay, we tape them all the same way.
The other toes, you trim the tape down to be as
you're gonna. So if it's this toe right here, you're gonna do the same thing you did here, but this way I'm only gonna use this much of the tape.
Yeah, like half.
Yeah, so I'm just gonna do this, and it's probably gonna be a little smaller too. And this also might be where you need help too. So the problem is the runner ain't going to be able to help you, because his back's going to be sore, or her back's going to be sore. They're not going to be able to lend forward. Just come here. I just picked on you because you're quiet. Never be quiet in class.
The quiet observer.
So this, I'm going to have to do this and do this. And it's okay if they overlap a little bit before you trim them, but always make sure that if it overlaps, see how this is kind of overlapping? Make sure that you do this and then tuck it in and then bring it back over, okay? And then what I need you to do is I need you to open these toes up for me. Just hold them like that. And you can take this tape and kind of pull it a little bit, because again, it's a little bit malleable. If I cut your toe, let me know, because I have my glasses on, okay?
Ow.
And it starts bleeding.
Have a later. Yeah.
Just got the toe right off, yeah.
What blister?
You know how to take that mind off that pain?
That now horrifies me.
I made a mistake one year. This guy brought anesthetic out with me, and this guy's like, I brought lidocaine and Marcaine out with me, and the only problem is I didn't have anything but an 18 gauge needle, and so I digital blocked him, and put an 18 gauge needle in somebody like that is not very nice. I probably shouldn't have done it, but he really wanted me to do it, so I still need your help. Where'd you go? I still need your help. And you could see how this one's opened up a little bit, and that's okay, because we're going to cover that up. So open up his toes for me. You can bend him down a little bit. Bend him down a little bit.
Okay.
Bend him down.
Okay.
Yeah, bend him down. And you got to be careful about this right here. So if I go too far down here, like if I go in here, what's going to happen to this is it's going to roll up, and now you got a stone in your shoe. So you got to be very careful about how far in here you go or how far down, okay? So just be aware of that.
And it goes right in the...
Right in the crease. I go right in the crease, okay? You can go just above it, but try not to go just below it, okay? Now, so you see how nicely that is? So this is gonna keep this from unraveling. This is gonna hold this in place, and this is all gonna be good to go. So those are toes. That's how you tape a toe. That's kind of what you're looking for, is this smooth. There's no big ridges or anything like that. Nothing like that. It's all smooth, and it's gonna be nice. Okay. Now, one of the problems that people get is,
Oh, your pair of socks or something.
so one of the problems that people will get is they'll get a blister right in this area right here, okay? And it's really hard to tape that, okay? So how can you treat that, okay? It's not a problem, trust
That
me.
is what Brent taped for at Western States, the ball of his foot. I
Yeah,
guess he's...
the whole ball of his foot, or
Yes.
just,
Yes.
Okay.
He learned it from you.
yeah, probably,
He did.
yeah.
He told me. And whatever you taught him lasted the entire race.
Yeah, it's awesome.
Yeah, right?
It's nice to know that I have some level of impact.
You do. For 100% you do.
Yeah, I like to think that. It doesn't always work out. So I'm going to talk about this, and so just like she was saying, it doesn't matter if it's one toe, it doesn't matter if the blister is just in this area or if it's a larger area. It's all the same way, okay? But I want to do this once so then you guys can practice yourselves, okay? You guys are going to team up and practice on each other. And I'm just going to watch, because that's what I like to do, be a voyeur, okay? So I'm going to look at this right here. So I'm going to take this, and I'm going to kind of do this and go, okay, so I want to go up here, and I want to go down here. So I want this to be bigger, okay? And there's a reason for that, okay? But I want to, because you know if the blister started here, it's going to encompass that metatarsal head right there. So what I want to do is this. So I see, okay, so I got this right here, and I'm going to cut this right here. I'm going to round this edge right here. Always round the edges. Always round the edges. You're missing a Facebook post, man.
It's my mama texting.
Huh?
It's my mama texting.
So what I'm going to do is go back in here, and I'm like, okay, this is always hard for me to remember, but what I want to do is just do this. And you may have to adjust how wide you make this, or how short. This may be too much. It's actually not bad. I'm gonna bring that up a little bit. Cool guy. I was teaching a class to somebody at one point, and they kept doing that. They kept trying to like pull the thing off. I'm just like, stop it, be a cool guy. Okay. So I'm gonna take this, feed this in here. I'll take this. I don't want that. Stop it.
Put the screen protector on.
And by the way, you just missed the cutoff.
Shut up.
Let's see what we have to deal with up here.
That's messed up, man. So see how stretchy this is? That's why I like to use the KT tape, because it's really stretchy.
Don't rush your crew, it just makes it worse.
Yeah.
So see how now I'm taking this, I'm kind of heating that up so it sticks in there better. Okay, that's not going to be good enough though, because if you don't do anything with this, it's going to pull up. Okay. So again, what I'm going to do is, like, if it's bigger, I'm going to come over here, over there. I'm going to come over, okay? But this is where I need help to open. I don't need that now. I'm not going to do it, okay? Because I want you guys to have some time. So then what I'm going to do is I'm going to take this.
And that's actually, what you're doing there is, because I had a hot spot.
A hot spot or a blister.
You did the bottom, like.
Right.
There,
Yeah.
My toes were fine, it was just a hot spot.
A lot of people get a hot spot here. I always say, if you can do it, stop, take your shoes and socks off, air them out, and change your socks out if you can, and then try and do it without doing this. But if you look down and it's, because like a lot of times it's just that. It's just because it's just irritated. It's
Right.
not even like really hot.
And I probably, hindsight, I probably didn't even need to do that.
Right.
But what did it was.
Yeah.
First time I'd come across that.
Yeah.
Augustine actually the one that said, hey, go see the Meg, he's really good at this.
And are you doing any stretch to speak of there, or
Just a little, just to keep the creases out.
If you're helping someone, do they need to have their foot relaxed?
Yeah. No, just in a neutral position.
Okay.
In a neutral position.
So now I may have a stupid question, but why didn't you just do the once around? Why'd you have to go?
Because you can't get this tape up here.
Oh, okay.
You can't get the tape up there.
So
Okay?
that's what that did. and-
Right.
Got it.
Yes.
Okay.
The tape, you can't get this in and down. You can try, but it ain't gonna hold.
Okay.
It's not gonna hold. Yeah, it's not gonna hold.
That's
Okay?
what I've tried to do.
Use the shortcut.
And then just
I'm thinking,
flop
why
it
can't I
around in
take
my
the
sock,
shortcut?
and
Yeah.
I'm like, well, that did no good.
Yeah.
Okay. So that's how you do that. See how nice that is? See, it's nice and smooth. I think I got a little crease right there, but
Start a company.
huh?
You should start a company.
I should. I might name it Trail Toes. So you see how nice that is? And again, you can make this pad that you put on here, I might have made that a little bit too long, okay? So let me talk about that, okay? So anytime that you're taping, okay, you always want to tape back forward. So proximal to distal, okay? And I'll show you why, okay? So say look, I'm not happy with this. I got this exposed right here. I want to make sure I cover this up so it doesn't peel up, because look what's going to happen right here. That's going to peel up, right? So I don't want that to happen. So this is what's going to happen. If I'm just going to take a real quick piece. I'm not going to do anything fancy with it. I'm just going to do this real quick. What I want you to see is when I do this and say I want to cover this up right here, okay? And again, this isn't how I do it. I'm just doing this really quickly, okay? And again, I would have rounded the edges and all that, but what I want you to see is this. See how that layered is right there? So when you start to run, you can't see it, okay? But you see this right here? So when you start to run, especially if you start to run downhill, as your foot slides in that shoe, this is what's going to happen. See that?
Yep.
Okay? So what you want to do is, if you're going to do multiple layers of tape, like say I was going to put another piece of tape on here. Let me just take this off real quick. And again, I'm just going to do this real quick so I can just show you the difference. So say if I wanted to cover that, I want to start back there, right? So I'm worried about that piece right there being exposed. Yeah, come on. So what I'm going to do is come back here first. And again, I'm just doing this really quick, okay? But I just want to prove a point to you. How much money I'm wasting right now. Go ahead, put your foot down. You're not hurting me. No, put it on put your foot here. You're not hurting me, man. I know your hips are like going crazy right now, isn't it?
Yeah, I'm good.
So what I'm going to do is layer this. And again, I would make sure that's all smoothed out, okay? I would layer that. I just waste more money, whatever. Just remember me. Remember that I did this for you guys.
Kind of like lapping siding in there.
Yeah, I don't know what that means, but maybe. And you see when I'm doing this, this probably maybe a little bit, about 50% is what you want on your overlap, okay? That one's probably a little close. But you want about 50% on your overlap. And again, be careful about this one right here because you don't want that to curl underneath his toe. But this would all be smoothed out. But see, now when he runs,
That makes sense. It's so simple, but you don't think about it until someone.
well, no, it's because, and nobody, even like people that do this don't really know that either, because what they see is this, and so they start working down this way.
That makes the sense. to me.
Okay, so it's the same thing. Okay, now I'm just going to talk about real quick. So if you have, okay, let's just talk about a blister real quick. So say I have a blister. We don't really talk about that. Okay, say you have a blister. The first thing you're going to do is take your alcohol and you're going to clean it. Okay, next thing you're going to do is you're going to take a needle, or you're going to take your pen. What we're going to do is you're going to take your needle.
Now you're wondering, what did I volunteer for?
Yeah,
Well, I was like, well, I didn't bring a blister with me.
yeah.
Come prepared.
So what we're going to do with this is, if this is a blister, I don't really want to pop my shoe. We could do this right here. We do this just for demonstration purposes. So this is my blister, right? My blister's underneath this skin. This is skin, and my blister's underneath it. It's a round circle. What I always tell people to do is, I should probably have my glasses on when I do this, so I'll stab myself. But what I tell people to do is this. So find the blister, clean it off with your alcohol first. So I'm going to take my alcohol. There's alcohol right here. Just so you can see it visually. Just take my alcohol. I'm going to clean this off. And there, always start kind of in the center and go out like that. That's what they say. Don't. Just clean it as best you can. Because really what you need to do is, that's what your skin's going to look like when you do it. Yeah. So make sure it's clean. What was that?
Fly.
Oh, I thought it was a tick. That's a brave woman.
It's a big ticket.
So if this is my blister, what I'm going to do is, this is my circle. What I'm going to do is I'm going to go in one side and I'm going to go out the other. But that's not enough. See, he thinks he's all smart. Okay. What I'm going to do is then I'm going to come back this way, and I'm going to go in this side, and I'm going to come out this side. So now I have 4 holes. A lot of people will tell you that what you can do is you can cut the edge of it. The problem when you do that is you leave a flap now. And so depending on where you do it, so if I have a flap, so if I have a blister right here and I cut down here, maybe a little bit better, but if I cut up here, now when I'm running, what's happening? Now you create that fold and it's going to rip right off at some point. These will close up at some point, okay? But I always like to have 4 holes, and then what I'll do is I usually use the alcohol and I'll push down, I'll clean it with the alcohol again, as I push down, and then I'll take my 2x2. Ow, I have a frozen shoulder, so it's really hard for me to reach behind. Then what I'll do is I'll take my 4x4, and that's why you want to have the sponge. Is it the sponge? Yeah, not the pad. You want to have the sponge. Yeah. And then what I'm going to do is push down on this. This is going to help absorb all of the fluid. Okay. Now, if you're European, okay, and you're doing a stage race, what they'll do is they'll take a needle and a thread, and what they'll do is they'll feed it through, and then they'll leave the thread in place overnight. They won't dress it, they'll just leave it in place to allow it to drain. Then they'll take the suture out in the morning, and then they'll tape it up afterwards. I don't know about that. I mean, it is a way to do it. The problem is that you're in a really nasty area. You really haven't had a chance to clean it, so you are leaving it open to the environment. So there is a risk of infection. Okay, so that's how you take care of that. Okay, and then if you are doing a stage race or something like that, what I always tell people to do is if you get a blister during the day, when you get done, take everything off. Let your air dry. Your feet dry out completely, and then in the morning give yourself enough time to dress your feet in the morning. Okay, especially if it's the first day and you got 5 more days to go on those feet. Okay, so that's taping this. What else should I cover? Oh, subungual hematomas. So if you do get that blister underneath your toenail, are you ready for this? Mm-hmm. This is gonna hurt. Okay, this doesn't hurt because your nails don't have any nerve endings in it. What do I do with the needle? There's a needle running around here someplace. I'm gonna sit on it in a minute. I'll find it when I sit on it. Anyway.
You're responsible if any of our customers come in and start coming,
Yeah.
What are y'all doing in here?
Why are there loose needles on the
Yeah. So if you get a blister underneath your toenail, what you want to do is, I'm not going to do it. Okay. What you want to do is you take this right here, kind of push up on this right here, and you'll take this and you'll just drill this right into the toenail. Okay. Well, it helps. A lot of people will do is like they see the blister out here, so they'll pop it there. The problem is that when you do that, you now have it opened and it's just going to tear right off. Okay, so if you do it back here, and I don't do it once, I actually do it 3 times. Okay, and the reason I do it 3 times is because these are going to cover up at some point. They're going to close off at some point. So the more I have to allow the fluid to drain out, and as soon as you do this, it's almost immediate relief. Okay, but you gotta, it's one of those things. And you can also use the needles. You can take these and you can heat these up and you can put them through like cautery. The problem is that you won't necessarily get a sense of where the needle is until you you hear the sizzling of the fluid come out, and then it may be too late. Okay, you gotta be very diligent. You got to be very, very cautious when you do this. You got to do it slowly, okay? And you have the onychomycosis, so you have the thickened nails. Yours are a lot harder to get through, okay? So yours are going to take a little while to get through.
Okay. I wrote down a note to get my toenails removed.
Yeah, okay.
Yeah. That's how I didn't know you could do that.
Yeah, you can do it. You don't need them. You're not rooting for anything. That's what they're for. I mean, that's what your nails are for. Yeah. You know, fighting. We're not fighting with our toenails. Yeah. You know? Not that I know of. I don't know what you guys do on Friday night, but okay. Yeah. So
we would probably not do that if we were on somebody's crew, right?
You should.
People do that?
Absolutely.
And where exactly does it go again?
So what I do is I just kind of look down here at the base. So I kind of look right through here, and you very slowly, you're just going to do this. You're just going to drill right into the toenail.
Like right at the, where the...
Yeah, right here. Right there.
Okay.
Just like that.
Right.
And you push down on it.
You push down on it. Yeah, you're just pushing down as you go in, and you just go.
Eventually, you'll start seeing the.
You'll see the fluid come out. As soon as you see the fluid come out, Go just a little bit longer, but don't go all the way in, because that tissue underneath there is not used to being exposed to the air, and it's certainly not exposed to a needle being put in it. It's very, very sensitive. So you got to be very, very cautious when you do that.